To help keep antibiotics working, Public Health England and partners have developed an antibiotic checklist for pharmacy staff. This checklist aims to help you provide personalised self-care and adherence advice to each patient when dispensing antibiotics. It contributes to the national Keep Antibiotics Working campaign. This video will describe how to use the antibiotic checklist and will last about 5 minutes. There are 3 stages in the journey of an antibiotic prescription in the pharmacy: the hand-in stage, the dispensing stage, and the hand-out stage. The checklist supports each stage in the antibiotic journey. Hand-in. At prescription hand-in, ask the patient or carer to complete the red patient sections, which provide information to help you check that the antibiotic is the right type and dose for that patient and that infection. Explain that the patient or carer should answer the questions by ticking the boxes. They might need your help. The customer can complete the form for themselves or for the person named on the prescription. We ask, are you taking any other medicines, so that we can check for any interactions between medications? We ask, are you allergic to any antibiotic? Because NICE guidance recommends asking about timing and type of antibiotic allergies. We ask, have you taken an antibiotic in the last 3 months? This is because if the patient has had an antibiotic in the last 3 months, they are more likely to have an antibiotic-resistant infection requiring a different antibiotic. This is especially true for UTIs. We ask, do you have one of these common infections or something else? This is important so that you can check the antibiotic against local antibiotic guidance. It also indicates which information leaflet should be shared with the patient on handout of the antibiotic. There is space for them to record another infection. We ask about other conditions to make sure the antibiotic and dose is safe for the patient. We ask, have you had a flu vaccine this year, as many patients can have a free flu vaccine? If patients have not had a flu vaccine, staff could book an appointment whilst they wait for their prescription. Vaccines are very important to help reduce the spread of infection and antibiotic use. There are a range of leaflets on specific conditions available. Patients may request information in their own language. We all know that we should be giving lots of advice to patients about how to take their antibiotic, but we rarely have time to do this well. The knowledge section helps you find out what the patient doesn't know, so that you can give the most helpful information for them and their antibiotic. We ask if the patient can be contacted so that PHE or the pharmacist can contact them to get some feedback about their pharmacy visit. Please encourage completion and remind customers that their details will not be used for anything else. Dispensing. The antibiotic checklist also supports you when dispensing an antibiotic. This part reminds you to check the risk factors from page 1 to ensure the antibiotic and dose prescribed are safe. If you are unsure of local antibiotic guidelines, you should contact your local medicines optimization team. If the antibiotic does not seem correct, then you should speak to the patient to find out if there are any reasons for the prescriber's choice. They may have had treatment failure on a previous course. If concerned, you should contact the prescriber for advice. You should use this section to record the antibiotic given. Note the space for extra information to be obtained from the patient or the prescriber. Handout. You should complete the giving advice section after checking the patient's knowledge about antibiotics. Ticking the pink circles helps the pharmacy to audit the information given and improve their service. You can recommend a specific information leaflet to support self-care and prevention advice based on the reason for the antibiotic and the language or pictorial needs of the patient. The leaflets also contain safety netting advice and signpost patients to appropriate services they can access out of hours. There are several respiratory, urinary, dental and children's leaflets available on the Target website. Pictorial leaflets are useful for those with reading difficulties. If possible, you should share the leaflet information explaining to the customer when they should seek help and how to access this help. If the patient would like to discuss antibiotic resistance further, or is concerned that they may have an antibiotic resistant infection, you could signpost them to Antibiotic Research UK's dedicated patient support officer and give them a leaflet to take away. You should use the final section to record flu vaccine information. If it is not possible to complete this form, it is helpful for PHE to understand why. User feedback indicates that this antibiotic checklist can help structure your patient's self-care, safety netting, and antibiotic advice, save you time, facilitate audit of the advice. Thank you for using this antibiotic checklist.